Before learning about the corticospinal tract, let's have a look into the functional areas of the brain involved in the pathway of the corticospinal tract. In the frontal lobe, there is the primary motor area with Brodmann area number 4, which is located primarily in the precentral gyrus. Then we have the secondary motor area with Brodmann area number 6 and a part of area 44 and 45, which are located in the posterior parts of the superior, middle, and inferior frontal gyrus. And we have the primary somatic sensory cortex with Brodmann area number 312, which is located in the postcentral gyrus and posterior part of paracentral lobule. Now let's have a look into the nerve cells of the cerebral cortex. The cells present are pyramidal cells, stellate cells, fusiform cells, horizontal cells of Cajal, cells of Martinati. What are the cerebral cortex layers? They are the molecular layer, the external granular layer, external pyramidal layer, internal granular layer, ganglionic layer, also known as the internal pyramidal layer, and the multiform layer. Now, let's get into the tract. Pyramidal cells and their axons arise from the fifth layer, that is the ganglionic layer of the cerebral cortex. 1/3 fibers arise from primary motor cortex. 1/3 fibers from secondary motor cortex. 1/3 fibers from primary somatic sensory cortex. They then course through the corona radiata, internal capsule, midbrain, pons, and reach to the pyramid of the medulla oblongata. On reaching the pyramid, 80% fibers cross the midline and descend as the lateral corticospinal tract, pass through the lateral column of the spinal cord, and ends into the anterior horn cell of the spinal cord, while the other 20% fibers do not cross the midline and descend as the anterior corticospinal tract, then pass through the anterior column of the spinal cord, then cross the midline at the level of destination, and ends in the opposite anterior horn cell. The function of the corticospinal tract is that it controls rapid, fine, skilled, voluntary movements of the distal parts of limbs. Any lesion on this tract results in loss of these activities.